Thank you for joining us today for our Strengthening Families Networking webinar. Today we are focusing on perspectives on early relational health, which is both a concept we love to talk about and a series of videos that CSSP is releasing starting today. So we're excited to share it with you and very excited about how many of you are joining us today. Just a few notes about these webinars before we get into today's content. We do this each month. It's an open invitation to anyone who's interested, which is primarily those who are using the Strengthening Families Protective Factors Framework or coordinating Strengthening Families efforts, whether that's for their organization or their state or some other level. We jointly convene these between my organization, the Center for the Study of Social Policy, and the Children's Trust Fund Alliance. Each month we have a different topic, usually with guest speakers, and we welcome your suggestions or volunteers to share things on these webinars. And there's a link there where you can go and find recordings and materials from past webinars, actually from about, 12 years worth of monthly webinars. There's a lot there. But if you miss it one month, or if there's a topic you remember was covered sometime last year that you want to dive back into, you can always go to that site and scroll through those archives. And I should say we also send out the recording afterward. If you have registered for the webinar, you'll get a follow-up email the next day with the recording. So we do these the second Thursday of each month. In March, we're doing something we do about once a year, every year and a half, a Strengthening Families Implementation Technical Assistance Clinic. So whatever questions you have about Strengthening Families, you can submit those when you register. You can email me, or you can just ask them live on the webinar, and we will try to answer them, and we'll hope that the rest of the people on the call will also help answer. So even if you don't have a specific question, you can jump in to share your responses. It might be questions about the concepts in Strengthening Families. It might be questions about sort of how do you message this to a certain audience, or I've been getting this question a lot lately, and we can discuss those. So please join us. They're always rich conversations, and always enjoy hearing what you're all hearing out in the field. So the registration link is there, and I will put that in the chat once I stop talking. And you can mark your calendar for the second Thursdays of the month coming up. We have some great topics coming up, and we generally just announce those the month before. All right, so for today, I'm very pleased to be joined by my colleague, Dr. David Willis, who is a senior fellow at CSSP. And we will be talking about the Perspectives on Early Relational Health video series that's coming out now, and also just about early relational health in general. And then we're excited to discuss with all of you how early relational health relates to Strengthening Families, the framework, the approach, the work, all of it. We will wrap up, as we always do, with updates from the Children's Trust Fund Alliance, which Maureen Holliker is here to share today, and I'll share some updates from CSSP. So that's our plan for the next hour, and we're excited to jump into it. So David, I'm going to hand off to you, and you can let me know when you'd like me to switch to a video.
That's great. Thanks, Karen. Hi, everybody. Welcome. Thanks for joining us today. And you are a special audience that gets the first releases of our little videos, vignettes about perspectives on early relational health, a series of videos we've been making to bring forth broad perspectives of what we're talking about as we address early relational health. And to tantalize you before we talking how this was developed and what this is all about, we thought it'd be valuable for you to see one of our favorite of the elements within the video series themselves. My friend Zhanlei Li, who's a senior lecturer in early childhood education at Harvard Grad School, and I were having a conversation, and we were actually focused in on what kind of system supports could be made available to help support early relational health in families. So you'll see me, I think, make that comment to Zhanlei, and then he will, for the next 2 to 3 minutes, talk about his beginning perspectives. And this is representative of what we've created within these various perspectives, these voice and dialogues. So Kaylin, roll the movie. Comments about 2 or 3 key elements of systems change that you think would provide the strong support for relational health. What's your view?
I think we can start on this idea of thinking in parallel processes. So if we start with a child and we think about responsive care, what does responsive care mean? Well, it means that when the child have a need, the child can signal to the caregiver that they have a need, The caregiver then responds in a way that makes that child feel seen, heard, understood, and the caregiver then adapts their behavior. But instead of now thinking about this process as particular to infants, think about any human being that is involved in this early relational health system. They have needs, and they find their ways to communicate their needs. They send us signals. Sometimes even through their struggle, they're signaling to us what their need is. There has to be somebody there that can see them, that can hear them, and that can act in a way that adapts to their need. So in a way, right, in that parallel process, making sure that everybody has somebody, and everybody's signal for needs is seen and heard by somebody. And if we build a system, and in that system, whether the actors are infants, or the people who care for infants, or the siblings of the infants, or the professionals, let's say home visitors who are supporting the infants, if everybody in that picture has somebody who can see and respond there to their need, then collectively we have a system that works.
Okay, Kaylin, thank you. So all of you listening, we all love Jean Lay for the obvious reasons. Next slide. And he captures one part of the key message of these perspectives of early relational health is that all relationships matter around families and the youngest of children. And the context around families and in the neighborhoods and the systems and the communities matter in terms of supporting an early relational health frame. We all know that relationships matter. We all know that when we talk about early relational health, we're talking about those safe, stable, and nurturing relationships that support physical health and development, social being, and resiliency. For some of you, it may be a new term, but it's really not a new field. It's built upon the discoveries that have been from decades of research in child development, infant mental health, neurodevelopment, but it does focus on that centrality of relationships and caregivers and their very young children and the contexts and environments within which they live that shape future health development and social emotional well-being. And it all starts really early. If I can have the next slide. What has gotten us really ever more excited is that after many, many years, my colleagues in child health and pediatrics have likewise got ever further in pushing that partnering with families and communities to promote relational health is a significant paradigm shift that has to be absorbed into health system and community and equity transformation. This quote here is the first sentence of the new AAP policy statement. And I want to read it because it's so compelling and represents everything that we believe in, everything that we try to touch on, the perspectives around early relational health in our series. But by focusing on safe, stable, and nurturing relationships that buffer adversity and build resilience, pediatric care is on the cusp of a paradigm shift that reprioritizes clinical activities, rewrites research agendas, and realigns our collective advocacy. And as my dear friend Andy Garner says, and I would quote him saying, protecting against adversity and promoting early relational health are the opposite sides of the same coin for the same purpose of well-being. So the opportunities that are growing really mean that health systems interest matters as they are a platform of touching and partnering with families, but really what happens in communities with all the other organizations and touch points in support of families matters too. And that relationship building between pediatrics, public health, community health workers, family community supports, and all have to be working together to support that relational framing. In our perspectives, we try to capture that breadth. And can I go to the next slide? Kaylin, thank you. There's a lot of work going on around this early relational health space, not the least of which is what you may have heard Reach Out and Read Network has taken as its next chapter agenda, building the strengthening foundational relationships for the foundational work of early literacy. They recognize that in their partnership with families, that, as I heard from my friend Depeche of Syria, Reach Out and Read is actually secretly a parent support program. It's all about supporting the relationships strongly. It's book sharing in terms of an activity, but they're moving their focused effort ever more to strengthening foundational relationships and those dialogues with families. We also, you may be aware that, and the wonderful work we have at CSSP with Project Dulce, and many of you may be aware of the Healthy Steps model, or that sense of building out team-based care, that sense of high-performing medical home. The team-based models of medical care are advanced, child health practice are advancing. Within that is a relational framing, almost a relational health workforce commitment of partnering with families in a new way. There's work that's going on with measurement and video feedback and promotion efforts. There's work going on in terms of building on the strong parent and relational parenting intervention programs that exist in some communities. There's been recently increasingly dialogue around, with the ARPA policy movement, to Build Back Better initiative efforts, and the effort even with Medicaid and health system transformation. There's a lot of discussion about a relational health workforce intentionally in the maternal child health space. That effort, from doulas to community health workers to home visitors to the perinatal support efforts, both formal and informal, are part of surrounding and partnering with families in a relational, supportive way in order to really move this paradigm shift forward in new directions. And of course, the more local that work is, in neighborhoods, in communities, in partnerships, in early childhood systems tables, the more it is that we all work arm in arm about the criticalness of those foundational relationships and those supports around every new baby born to a new family, is what this relational health movement is really about. Next slide, please. So we knew that we've witnessed over the last 3 years of our coordinating hub at CSSP, a growing interest, of course, around early relational health in this framing. And you may be hearing it or seeing it in more and more places around you. And so we thought it'd be really critically important to try to get some key messages out as to what are we talking about in this broader sense, not so much in a depth of training yet, but rather creating a series of perspectives that are designed to frame, especially for community providers, as well as for the various programs and practices that touch families' lives, to really create a series of perspective video elements that could be used to carry our messages forward. So we set out to create, for multi-sectors and cross-sector workforce and professional development and ultimately technical assistance, some pilot perspective tools that bring forth an understanding of early relational health for community-based workforce that serve families and young people. So we hope that these are designed for community health workers, doulas, home visitors, lactation consultants, nutrition specialists, care coordinators, early childhood mental health consultants, public health nurses, systems builders, and the like, and that they're beneficial. So, and we had fortunate to have Brian and Cynthia Grant from the WRG Foundation to help support the development of these videos. Next slide, please. So we've created 4 and an introduction. 3 are completed. And Caitlin, how about if I turn to you now to take us a little further along this journey?
Yes, sounds good. Thank you very much. I want to talk about sort of what this full series looks like, and then we'll show a couple more clips so you get more of a sense of what these videos are like. The first one is called The Principles and Framework of Early Relational Health. That one is being released live on our website today. It wasn't there yet when I started this webinar, so I think but it will be by the end of the day. So You are really, truly the first to see these. And we will share the link to where you can find them on the website soon. That page will be live later today. So the first episode or session features David along with Marietta Callier-Wells, who is a parenting educator and a parenting program supervisor. And they really talk about what early relational health is all about, some of what David shared earlier today as well, but then really what Marietta sees in her interactions with families and what kind of supports families need and how critical early relational health is for everyone's well-being. So I'm going to share a little clip of that so you get a sense of Marietta's take and what she shares in the video, which I believe I can go like this. Someone give me a thumbs up that you can see the video. Okay, just making sure. This technology is not always predictable. So I'm going to hit play and we'll watch a minute or two of Marietta's perspective.
So early relational health just makes so much sense to me before I even knew that term. It's like I've been doing the definition of it all my life, and now there's a title that goes with it. But guess what? Early relational health and what it means, it's beyond the title itself. It's beyond all of us. It's something that is necessary so that everyone, every child, every family, every community across all cultures can be successful.
Could you talk about that a little bit? What do you see with the families you work with as to how this relational health work resonates with them?
The thing that really excites me, but it also honors not only what we're doing, but it honors across all cultures and the families, is that because of the relationship, because the trust is there, they speak about how much more can be done and how they feel so included when there is a trusting relationship. And in the relationship, so much more can happen because the focus is, yes, it's about the health, it's about being better. But in the relationship, you can talk about the more difficult things at that time because there is trust and because that voice is heard and they feel that someone cares about them.
So that gives you a taste of the conversation between David and Marietta in that first video. And like I said, that is out today. Next week, we'll release a conversation between Dr. Depesh Navsaria and Dr. Andrew Garner, both of whom David referenced already in this conversation because they are such leaders in this space. But they really talk about the paradigm shift in pediatrics. I'm going to share a clip where they're talking about that policy statement that David referenced earlier. But their conversation was actually really wide-ranging about how they work with families, what that interaction is like in a practice, in the clinical interactions with families. So I recommend watching that full video when it comes out next week. But I'm going to share a clip. It's going to take me just a second to get to that one. Here we go. Give it full screen. And here come Depesh and Andy.
Transition a bit here to really thinking about what's really different in the second edition of the toxic stress policy statement, because the first one really articulated beautifully about these concepts of toxic stress, of adverse childhood experiences, and so on. But the second one is really about prevention, about looking for the strengths, for the positive childhood experiences. And a quote that you've used that I think really encapsulates it beautifully is, preventing toxic stress and promoting early relational health are two sides of the same coin. Can you say a little bit more about that paradigm shift between the first and second editions?
Sure. Well, I mean, I think toxic stress by definition sort of occurs when there is significant adversity in the absence of the safe, stable, nurturing relationships that allow the body's stress response to quickly return to baseline. And then relational health by definition sort of refers to the ability to develop and sustain those safe, stable, and nurturing relationships that not only buffer adversity, but also practically build the skills needed to be resilient and to thrive. So they're both important frames to consider but they're sort of two sides of the same coin in the sense that one's what's happening in the absence of relational health and the other is what's happening in the presence of relational health. So again, I think in the midst of a pandemic and a reckoning with racial inequality, the toxic stress frame has never been more relevant, right? Because it explains how many of our society's most intractable problems, again, disparities in health and education and economic stability, they're really rooted in our shared biology, but our divergent experiences and opportunities. Whereas relational health explains how those individual, family, and community capacities that support the development and maintenance of those safe, stable, nurturing relationships, they also buffer diversity and build resilience across the life course. So again, it's sort of, it's not that one's necessarily better than the other. We need both. I mean, the idea that we don't need trauma-informed care, that's not what we're saying. What we are saying, though, is that just having trauma-informed care and addressing ACEs and toxic stress is not enough.
Okay, I hope that's enough of a teaser to make you really curious to hear the rest of their conversation. And you already saw a clip from what's going to be the third one release that will come out in 2 weeks with David and Junlei Lee, who is at the Harvard Graduate School of Education. And their conversation was very much about the universality of early relational health and the foundations of emotional connection. And then the fourth in our series, I can't put a specific date on it because, like many of us have encountered for ourselves or for folks we're working with, the folks who are going to record this video have all been dealing with illness in their own families and themselves over so far this year, and they're all healthy now. They're ready to record this video very soon, but we just haven't been able to get it on tape yet. So that is going to be between Dr. Dana Long and Nye Farn, who are both, Dana is a pediatrician and Nye is a community health education coordinator at UCSF Benioff Children's Hospital. And they will also be in conversation with a parent who participates in their clinic about how parent and provider relationships work when they are grounded in early relational health. So we're really excited for that one. Sorry that it's a bit delayed, but I think very 2022 feeling in how that had to be delayed, and we had to pivot, as we all learned to say 2 years ago, to figure out the best way to still get the rest of this content out, and we'll add that one in as soon as we can. So those are what the videos are all about. We wanted to talk a little bit about how you can use them, and here's the link where they will be posted. That link is not live yet. I'll still put it in the chat in a moment, but it will be live very soon. And you can just share these videos. We will be posting them on our social media from CSSP as they're released, and hoping other partners will either retweet or share on Facebook or create their own post to share them as well. But we also could picture folks using these in a staff meeting. So watch a video and then have a discussion about some of the topics that come up. You could do that with more than one of them or the one that feels the most relevant to your work. And we're really curious to know, based on the short clips that you've seen, how you think you could use them and what kind of conversations they would spark. And I should add, I don't think we've mentioned, they're each about 20 minutes long. So well, we would love to and do sometimes get to talk to these folks for much longer than that, and these conversations could go on and on. We've tried to keep them short so that they're more usable. So you could actually watch 4 in a row if you really wanted to, sort of a binge watching approach, or you can just use a 20-minute clip, a 20-minute video where it works for you. So really curious to hear if anyone has ideas right off the bat that you want to type in, yes, and I see someone put in the chat that link takes you to a page that's password protected. Yes, it has not gone live yet. Our communications team it's on their list for today to get that live, and it's just not quite ready yet. So we're on the cutting edge here, but we will get to it soon. And I'm pausing for a moment. I see Leah says we'd use it with our board and some donors. Yes, I actually think this is a really good way to convince people who might need some convincing about the importance of this work, or about what a paradigm shift can look like, and really hearing people who are passionate about it talk about it in this both informal but so well-informed way, I think is really powerful. I see Maureen saying we'll share as a resource in our strong training. So thank you for that, Maureen. And strong trainings are related to strengthening families. So it's definitely a strong connection there. And I see Laura typing, we'll use these as part of our infant early childhood mental health webinar series for a wide variety of audiences. Love that. I see Marilyn saying I'm part of some cross-sector statewide learning networks where we could watch and discuss. That's a great idea. And as long as you can figure out the technology, you can do this on Zoom to show a video or to send out the link and everyone watches the video and then you come together to discuss. And I see Carla asking, which social media platforms can I find the videos? They will be posted on CSSP's Facebook and Twitter. I think we will also post them on LinkedIn if you're active there. And they're not there yet. The first one will be posted today, which is when that site will go live as well. I see Rachel saying we're using this for Help Me Grow. Definitely a wonderful audience to talk to Early Relational Health about. And Debbie Jones says we'll share with our Early Learning Hub and home visiting networks. Love that. I think home visitors could really see themselves, see their work in these conversations and get some additional ideas. Okay, so I love all this conversation. I see there are a couple more chats coming in. Betty says we will use them at Connect Families. Karen says our fatherhood initiative and collaborative, wonderful idea. And Debbie Peterson says we'll share with our city council to help them understand the work they're seeing come up in community. Absolutely, and I think that first video, Marietta talks a lot about the power of relationships to help overcome times of struggle, such as most families have been through recently. So I definitely support that. Judy King says, oops, it scrolled. Judy King says we'll share with our child welfare colleagues and prevention partners in communities. And Maureen Durning says presenting at the Parents as Teachers Conference this year, and we'll share it there. Love all this. And Lindsay says we'll be sharing this with our home visitors and community partners in rural communities. Beautiful. Okay, I love all this sharing. We're going to move into how this all relates to strengthening families. So as you look at the questions on your screen, I'm going to just check these chat messages. Yes, David saying there are a series of presentations and additional resources. So that webpage will feature for each of the sessions some additional resources that the folks who are talking in those videos have shared that they think help to further elaborate on what they're saying. And those might be reports or other videos or tools, whatever they provided us with to further expand on what they were saying on the video.
Karen, it's fair to say too that they can be used as conversation and dialogues about the paradigm shift itself, because it really is a shift of thinking. Not for some of us, no, but for many, yes. And so, and one of the things we learned, I would say, from the framework study that we did a couple of years ago was when we say early childhood, people think of preschool and up. They don't tend to think about mamas, daddies, and babies. That prenatal to 3 space can sometimes be not in the dialogue. So ever more why the relational frame is really pushing on that prenatal to 3 space and those foundational relationships that build then social emotional well-being and later education readiness and the like. So languaging and framing matters. And early relational health is about those foundational relationships in that earliest period that so many of us know are really essential for future well-being, but also the context then that families have, where they live and their challenges or the vulnerabilities or the racism or the poverty or the stress, all of that disrupts relational experiences. Ever more, context matters as we talk of strengthening the relationships themselves.
Thank you, David. Wonderful. I also saw one comment, or this might have just been a question to the hosts about finding a way to show a 5-minute intro to a group of people who are interested in childcare centers to make them more aware of relationships and work with kids 0 to 3. I love that. We didn't explicitly mention this, but on the website when it launches, there will be a short intro video as well. which kind of gives the overview. It's David talking about why we're doing this and what the series is all about. And I think the other thing that we'll be looking to do is to put out on social media some of the short clips like we showed today that are more of a teaser, that for someone who's not ready to sit down and watch the 20 minutes. I see another comment here. We could name programs and this whole area pre to 3. I like that. And Deborah Chosewood shared that we will share this in our Georgia Reads What Happened to You landing page. So that's a group that's reading the book from Bruce Perry and Oprah Winfrey, What Happened to You, and in our Connections Matter trainings and conference workshops. That would be fantastic. Okay, and Catherine just wrote that Oprah has a CNN clip with Dr. Bruce Perry talking about that perspective shift to what happened to you and how love and relationships can buffer ACEs. They're so good. I'm so glad that those two got together to bring this content to such a wide audience. Hey, maybe we could get them to start using the phrasing of early relational health as well.
Now, Bruce does in his writing. We've just got to get a little deeper into the verbiage and then get it in Oprah's mouth. So we're let's move.
Getting there.
Yeah.
Okay, so whoops, I jumped. I did not mean to scroll there. Okay, so we want to get your thoughts because all of you came to this webinar presumably because you're connected in some way to Strengthening Families already, and you were curious or excited about early relational health. And so as we at CSSP are embarking on some work to better integrate our early relational health initiative with our Strengthening Families initiative, we are really curious to hear how you see the relationship. In some ways, how you see, some of you might say, well, I've already been talking about this and this is what I say. Some of you might just have thoughts brewing in your mind about how you see the connection with the Strengthening Families Protective Factors framework and with the approach of Strengthening Families. I do see someone put a question in the chat, Carlos, asking, is this framework similar to the Circle of Security parenting program? Carlos, if you want to come off mute and ask your question or just clarify in the chat. I'm not sure if you're asking about Strengthening Families or early relational health or both, because they both definitely have connections in relationship to Circle of Security. But if anyone needs a quick reminder or if you're new to this, Strengthening Families is a framework of 5 protective factors that we talk about, which are based in research and demonstrated to be correlated with optimal child development, reduced likelihood of child abuse and neglect, and promoting thriving families. So in case anyone found your way to this webinar but don't actually have the background in Strengthening Families. And it looks like Carlos was specifically asking about early relational health. So David, do you want to talk about how early relational health relates with Circle of Security?
Certainly. Circle of Security Parenting, Circle of Security Intensive are relationship-based intervention processes. Circle of Security Parenting is, in our conversations with their national leadership, they view as a relational health intervention strategy. So it's all compatible because it focuses so much on those foundational relationship experiences, and Circles makes it very visible and very applicable. It's a powerful, powerful support structure. There are some pediatricians and pediatric offices that I know are bringing that into primary care. My own view is some of the work we did in the development of early relational health was in partnership actually with the boys from Spokane, as old Catherine Barnard used to say of the gentleman that created Circle of Security. It is absolutely compatible and very important. And because it's relationship focused and separation reunion focused, trauma informed and the like, it's so powerful as a relational intervention beyond simply a cognitive parenting education process. So it's very experiential and I think represents so much of the fundamentals that we believe in.
Great, thank you. I'm looking at some other questions that have come in. One person, Debbie Jones, asked, how do we ensure there's not confusion with the Strengthening Families curriculum? And I think what we're actually trying to do is not have any confusion because they will be so connected that, as many of you know, we are in the process of updating Strengthening Families materials, doing a refresh to update the some of the language and then some deeper bringing forth of other topics. So we are making updates that touch on several areas, including how we talk about the effects of racism on families and the ways that strengthening families can be an anti-racist approach. Also updating how we talk about early relational health and other, newer understandings of developmental science, so that we're, addressing, the last time most of those materials were updated was 2014. And so we were talking about ACEs, but didn't have the research basis of positive childhood experiences yet. So we need to build that in. There's a lot of updates that are happening, but in that context, we are definitely paying a lot of attention to bringing early relational health into strengthening families, and then turning around and using a lot of the strengthening families framing to help operationalize early relational health and bring it out into the world.
Kaylin, I think that makes a lot of sense. I love these resources, and I think that when you first look at them, you might just think about social emotional competence of children. And then as you start to look at it, you see how it really flows through every single protective factor. And then also how these protective factors can, like you said, operationalize the concept of ERH. So I think it really falls in line with that. And I loved some of the discussion clips that you showed talking about, I think it could spark a lot of conversation around just strength-based theory and strength-based approach, and knowing that we can't just address toxic stress or, the idea of moving families from surviving to thriving, and knowing that we have to use early relational health and the protective factors in order to move families to that thriving spot, and that it's not a linear process. You don't have to do one first and then the other, right? You do them all at the same time.
Exactly. Thank you, Maureen. And I see a comment further up. It's hard to keep track of these chats when they're flying sometimes, but Karen Galuli suggested providing a parent cafe specific to parents of children prenatal to 3 and incorporating early relational health. I think that's a great idea, because I think often our parent cafes skew a little bit older, and parents are talking about parenting school-age children or preschool-age children at least. And so really focusing it down to that younger age. And of course, maybe there's some adaptations to make in logistics to make sure that those parents can get there, or to do them virtually, as some people have found parents are more able to participate on Zoom than arriving with kids in arms and all of that to it.
Kaylin, that makes me think about the centering parenting movement, which is also within the health sector, opportunities for families to get together in groups for well child care opportunities and dialogue, and how relational health actually centers in the middle of that. And there's beginning dialogues about how those processes begin to be ever more intentionally relationship driving and strength-based in those efforts.
Absolutely. I see a comment from Catherine here saying we refer to this as being human-centered in my organization, and that really captures it. Human-centered and relationship-centered, and not just focusing on the tiny human, but also the relationships that surround that infant or toddler. And I see Debbie Jones asking a clarifying question. We get this confusion a lot. So we are talking about the Strengthening Families Protective Factors Framework and approach, which is different from the evidence-based Strengthening Families program out of Iowa. Very much aligned and promoting a lot of the same outcomes, but the Strengthening Families curriculum is, sorry about the dog. The Strengthening Families curriculum really is a curriculum. It's designed, the various programs in it are for parents with children of specific ages or with specific challenges, whereas the Strengthening Families Protective Factors Framework and approach that we're talking about today is not a model, but an approach that you can use in any work with young children and their families. So not sure how you got on our list for this one, but I'm very glad you're here because I think it's all very related. And certainly the Strengthening Families evidence-based program also has a lot of relevance for early relational health when it's targeted to the parents of the youngest kids. Okay, I see a few other questions here coming up about possibly sharing these videos with the Grant Makers for Education Funders Collaborative. A lot of times they are thinking about ECE as it regards pre-K and kinder. As Dr. Willis referenced, an ECE funder should be educated to the importance of early relational health. Yeah, that's a great idea. And I don't
Yeah,
think
Jennifer, we welcome an introduction or a connection. We're connected to the health side of the funding groups, but less the early learning side of the funding groups. But always we would welcome further messaging opportunities.
I believe we had a participant raise his hand. Were you wanting to speak? I believe you can unmute yourself. Now I don't see that anymore. He might have lowered his hand because it's not showing me a raised hand anymore. If you were still hoping to speak, please jump in. Okay, I want to ask specifically this the second question on the slide, which some of you have been addressing in your chat comments already, but kind of what doors can we open with early relational health framing, and what doors can we open with strengthening families framing and discussion, and how can we leverage that access where they kind of are looking at two different fields in some ways right now, not entirely, but somewhat, and how we can bring those together to reach more people. I'd love to hear anybody's thoughts on that. And I see John's note that you can't unmute yourself. So do use the raise your hand function or type in the chat if you'd like to be unmuted. I can unmute you. And John, I don't want to preemptively unmute you if you weren't saying you want to talk. Okay, I see that we've got some more comments coming in the Q&A, and there, I think when we answer those, everyone can see them. So David's typing away, answering those, and I'm going to read one of them out loud. So this is from Catherine Myers. Is there a coordinated effort among those focused on ERH to do advocacy on behalf of families when it comes to economic support, like the child tax credit, which reduces poverty? Financial support impacts things like the parents' time spent with children. Reducing stress impacts their emotional availability for nurturing parent-child interactions. Absolutely, Catherine. And I don't want to speak for David, but I will say for myself, I think part of the strength of having the Early Relational Health Hub at CSSP is that we have a very strong and active policy team that is leading, for example, the Automatic Benefit for Children Coalition that's advocating for the child tax credit extension. And that does a lot of other work really focused on anti-racist early childhood policy and how we can do anti-poverty policy as well. So that's definitely part of this. And we're in frequent conversation with them about how that all relates to early relational health, but they certainly see the value of those supports for families. That's what they are all about, and they see the tie-in to early relational health as well as to other protective factors.
If I can lean in, Kaylin, you know how I feel about this, and in a couple ways. One, the policy implications of an early relational health initiative and agenda is very clear, and child tax credit is a big one. If you look at last week, there was the seminar from University of Oregon, from the Rapid EC. And if you look at the data of that ongoing monitoring of 40,000 some young families, month by month, sharing their experiences and the power of the child tax credit to reduce stress and to reduce the struggles in families is startling. Not surprising, but really important. Second thing is actually Tuesday, the Campaign for Grade Level Reading is having I think it's the Campaign Tuesdays, I forget the exact name, but you can go to their website. But we're going to be talking about the policy space of advancing early relational health from federal, state, local, with some state examples and what we're learning. So the message about child tax credit, reducing the stress around relationships and families has direct impacts on our relational health, and we're trying to elevate that in this space too. Thanks for calling that out.
Okay, I am trying to multitask, putting a couple links in the chat. One thing that is in the chat is if you would like a certificate for your participation in the webinar today, you can fill out a very short form. That's just your email address and your name, and certifying that you participated, and we will get you a certificate next week. But also the link to the video series, which, as someone pointed out, is currently password protected, but it is being shared, being made live soon. Maybe it is by now. And I see David, someone's asking for the link to the campaign for grade level reading.
I'm getting it right now. I'm about to put it in the chat. So prepare yourself. It's coming.
Great, thank you.
Yeah.
And I see Jim McKay mentioning the West Virginia campaign for the expanded child tax credit, how it makes life more bearable for children. Check out unbearablecampaign.com. It is very cute and very effective. So I recommend that as well. And I also see Joanna's comment here about the parallel process that Dr. Lee mentioned, because adults are often not treated with a relational health focus. And I think that especially parents who are from marginalized groups or have experienced systemic discrimination and racism, they walk into a doctor's office or something, they don't expect to be treated in a relationally health focused way, and they often aren't. And so how we can get more providers taking that approach with everyone who walks through the doors, and also investing the time it can take to overcome those past experiences and assumptions about how they're going to be treated, so people can really feel the difference and then respond, I think is really important. Okay, I want to thank you all for all of this conversation and discussion and enthusiasm, and we're going to move to our updates, and I will put a few more links in the chat while Maureen is sharing some updates as well. Here you go, Maureen.
Excellent. Thank you, Kaylin. So nice to see so many people on the call. So you can go to the next slide. I just wanted to take a moment to highlight some trainings that we have coming up, training of trainers, and they are open for registration. So we have a TOT on March 7th through the 10th, and then again on May 9th through the 12th. And I will, as we're speaking here, just take a moment to put those in the chat. See if this works. I think it worked. Okay. And on the next slide, it just really shows you that our trainings, we have produced over 1,600 Alliance certified trainers, which is pretty exciting. Looking at all of the different states that we have trained in, we've actually held 55 training of trainers now. And in addition to the upcoming trainings we have in March and May, we have 3 additional other training of trainers scheduled so far this year. You can go to the next slide, thank you. So for those of you that are not familiar with the training of trainers, it has 7 courses, and part of 3 common threads that you can see that really run through all of the courses are the framework itself, the protective factors framework and approach, culture, how culture runs through everything, the way that we build protective factors, the way that families build protective factors, and parent partnership. And we're going to talk a little bit more about parent partnership today and Parent Leadership Month. But the materials that we have include, academic content, videos, activities, exercises, audios from parents that really kind of just enhance the learning style across the board, adult learning styles. So, and then after the training, Alliance certified trainers are really continued to be supported through a network and a training support site, and networking calls and all of those kind of things, bringing folks together. You can take us to the next one, thanks. So if you didn't know, this is National Parent Leadership Month, and the Alliance is celebrating parents as heroes and community leaders. The Children's Trust Fund Alliance values and supports true parentship in really all of our work. and we work with multiple different parent groups that generate and create and really kind of individually and collaboratively create many different resources that are really part of their parent voice. So I'm going to share some of those with you today. Several of their most recent resources are featured on our parent voice page, and I will put that in the chat box in a minute. As you know, and probably all of you would agree, parent leadership is a necessary component that can help with building strength-based communities and communities thriving and really building those protective factors. So some of the materials you will find on the website are an activity calendar full of ideas on how to celebrate each day throughout February, an entire social media campaign full of activities, videos, and more, a sample proclamation complete with talking points, and a certificate to honor parent leaders within their communities. So I will put that link right now in the chat box. And then Kaylin, if you can go to the next one, thank you so much. Okay, so there's two different certificates that are available for download this year. The colored version represents the culture of the Alliance, and the black and white version can be filled in with colors that match the culture of your organization or your community. You can customize both versions by co-branding their certificate with your own logo and the name of the caregiver that you wish to honor. Obviously, we know culture plays a huge role in what communities look like and how families build those protective factors. We invite you to share your completed certificates with the Alliance and answer the questions on the submission form to tell us how the few submissions randomly selected to, there will be a few submissions randomly selected to win a prize. So head over to the website and tell us about your community. I will put that information in the chat box for you. Thank you. And last but not least, we invite you to join the Birth Parent National Network webinar, which is on February 17th at 1 p.m. Eastern Time, for a few new and exciting tools, resources, and updates. And I tried to do that fast enough so that we didn't run out of time. I'll put that in the chat box. Thanks so much, Kaylin.
Thanks, Maureen. And I will get into a few updates from CSSP. As I mentioned, we are active in the National Automatic Benefit for Children, which is continuing to advocate for a continuation of the extended child care tax credit or child tax credit. But while that work is still going on, we are also reminding folks and hoping that those who work directly with families will remind families that filing their taxes is worth it this year, even if they don't usually file. They can file by April 18th to get those child tax credits. If they have been getting the payments, if they got payments throughout the second half of 2021, they still have half of that credit to claim with their tax return. And if they didn't get the credit because they weren't already filers, they can file now and get the full amount. In addition, even workers without kids can get an increased earned income tax credit for 2021. So please use the flyers that I just posted links to in the chat. We have flyers in English and Spanish to let parents know the value of filing their taxes this year and where they can go to do that for free and where they can get assistance with it. Please share those far and wide and stay tuned on the advocacy for extending that child tax credit. So I also wanted to share that CSSP is hiring. We have job postings up right now for a senior policy analyst on our policy team working on some of those safety net and child welfare issues. We also have a listing up for a program analyst who will be supporting our parent leader network, our technical assistants to Promise Neighborhoods, and some other really exciting work. So if you're interested, or if you know folks who are looking for work, please check out our website. And I put a bunch of links in the chat all at once before I started talking. So that link is in there as well. I also hope you've all heard that the annual HOPE Summit, that is the health outcomes of positive experiences, closely related to everything we've been talking about today. The annual summit will be on March 8th. It's on Tuesday. It's not quite a full day so that it works for all the time zones. But they're also doing a week of hope where there are events each day that you can check in on. Like one day is a Twitter chat, one day is another webinar. There's a lot of different things going on. So I encourage you to check out what's going on with Hope and register for the summit. There's actually an early bird registration level, which is good through tomorrow. So check it out while you can, but you can also register at the regular rate after tomorrow. And exciting news for further out this year, we are planning the Together for Families conference, which will be a virtual conference this year. Again, it was very successful as a virtual conference in 2020, and we were very excited with how many people were able to attend. So we're keeping it virtual for now, and that will be October 19th through 21st. The website just went live, and I should say that CSSP co-hosts this conference with the National Family Support Network and Families Canada. And we have a bunch of partners on a planning team. This year, for the first time, we have a parent leader committee as part of the planning team to really make sure that it is a welcoming and developmental experience for parent leaders who want to participate as well. So we're really excited about moving forward with this conference again. You've all been great participants in it in the past, and I hope you'll be able to join us again this year. We are currently looking for session proposals. They're due March 2nd. I will be emailing that out to many groups as well, but the link is in the chat if you want to check and think about a session that you would like to propose for that conference. We'd love to have you. Finally, I wanted to share how you can stay in touch with CSSP's work. Partly I wanted to share this because we just launched a new Early Relational Health newsletter, which many of you probably aren't getting yet. So you can go to our website and sign up for that. If you don't already get any of our other newsletters, it's a great chance to update, check in on what we've got. It looks like we have 6 opportunities for newsletters. Each of these goes out monthly or less than monthly, so we won't be flooding your inbox, but we encourage you to subscribe to those that relate to your interests. And then you can also always go to our events page on our website to find out about upcoming webinars and events. So for example, next week, David is doing a Willis and Friends session, which is a live broadcast conversation, and this month's is about toy pollution and how that relates to early relational health. So something that if you work with young children and their families could be very relevant, and just always new ways to bring in more voices talking about early relational health and different angles on it. So thank you all for joining us. I'm putting CSSP's contact information here. If you don't already follow us on whatever social media you're active on, please do, particularly because that's how you will know when that video is actually released, the one that's coming out today, and then the ones that'll come out in subsequent weeks. And you'll be able to find those, share them. You can share them as they come out, or you can wait till the whole set is out and share it that way. But we are just really excited to see where this goes and what you all think of it, and really grateful for you joining us today. David, did you want to say anything else to close us out?
Other than thank you, Kaylin, for hosting this interest of ours with your Strengthening Families Network, and we welcome all feedback, positive, negative, what to do and